I think as we look at the process that we just went through in this HELP committee, it's important to recognize what happened and what didn't happen. We're kind of having competing press conferences here this morning, and on the Democratic side, they're saying that this was a bipartisan process, that many Republican amendments were accepted, and while the vote may have been 13-10, that there was a level of fairness throughout. Let me just give you an example of the amendments that were accepted from myself. We had about 20 amendments accepted. That's pretty impressive for a Republican. But they were all technical amendments that spoke to, in my situation, making sure that the language within this legislation allowed for Indian tribes to be participants, whether they be in health care grants or what have you. So we had gone through the draft and ensured that there was a level of, quote, equity provided for our tribes across the country. Each one of those was counted as accepting a Republican amendment, and now somehow or other this is a fair process. It's a bipartisan process. Some of the other points that need to be raised with this legislation, and my colleagues have done a good job in outlining them, but when we talk about the impact to small business, I think it's important to recognize that things can go on one side of the hill, and then through our laws of unintended consequences, we can really foul things up on the other side. With small businesses, right now the administration recognizes that where this economy is having a very, very painful impact on small businesses around this nation, the businesses that keep this country going. And so they're looking at possibly using TARP funds to provide for a level of bailout. Now, whether or not you think that that's right or that's wrong, that's one of the considerations. But here in this committee, what we have done is we've said, okay, small businesses, we're going to assess a pretty substantial tax to you. If you are an employer that has less than 25 employees, you're okay. But if you're an employer, a small business that has, say, 50 employees, you're going to be taxed at about an additional $20,000 to you. So on the one hand, we're saying, well, we're going to give you a temporary bailout, but we're going to impose on you for the long term a tax to our small businesses. Where are those small businesses going to go if they can't pay that? They're going to shut their doors. We're going to lose those jobs. We're not helping. One other aspect that I have been bringing out repeatedly throughout this markup is the access issue in rural America. About 17% of individuals in this country, according to MedPAC, have limited access to a primary care provider. They're just not there. And what we're doing through this legislation is we're squeezing it down. We're saying that the reimbursement rates here under a government-run plan may be even less than what the Medicare rates are paying you now. My doctors in Alaska are saying, we can't participate in a plan like that. We won't be participating further in Medicare. So where do our people go for care? We might be giving you a card that says you're covered, but if you don't have a provider that can then see you and address your medical needs, we haven't provided anything for Americans.